Welcome to Local Doctors on Call. I'm Suzanne Lee. Thank you so much for joining us. The telephone number that you will need first and foremost tonight is 361-4675. That is the telephone number that you will be able to call directly with our guests here. I'm joined tonight by Dr. Misha Payant from East West College of Medicine, and also Dr. Stephen Roensch with East West College of Medicine. I would really like to introduce both of you gentlemen by having us tell us a little bit about yourself. So, Dr. Payant, tell us a little bit about yourself and how you became involved with East West College of Medicine.
Well, I have a bachelor's degree in nutrition, a master's degree in oriental medicine, and a doctorate in acupuncture and oriental medicine, with 2 specialties in gynecology and geriatrics. So after I finished my degree, I opened a private practice in Chicago, and then I decided to move to Florida where it's a little warmer, and I became the president of East West College of Natural Medicine.
And please tell us, Dr. Roensch, a little bit about yourself again and how you became involved with East West College of Natural Medicine.
Well, when I was a very young man, I found myself in the Republic of Vietnam at the service of my country. And one of the responsibilities of my platoon was to patrol the area called Cholan near what we used to call Saigon. And that's the first time I ever saw acupuncture being performed by local Chinese missionary doctors on the local population. They were treating them for the effects of malaria. And I struck up a dialogue with one of the physicians who was very fluent. And it just was like a seed was planted. And of course, a lot of years would go by before I actually pursued it. But I'm a graduate of East West College. And today I find myself a Dean of Clinical Sciences there.
So East West College really does several things. So tell us a little bit about what you do and how the public can actually come and be doctored, if you will.
Sure. Well, at East West College, we teach oriental medicine, but it's a very integrated program. So we teach Western medicine as well as Eastern medicine. We all practice a little bit differently, and how I practice is I use functional medicine. And functional medicine I could refer to as intelligent medicine or rational medicine. The medicine that is practiced today really isn't very rational. The conventional style medicine today is very pharmaceutical based, and when 50% of the patients don't take their medication as prescribed because of all the adverse side effects, there's a whole problem with that paradigm of medicine. So with functional medicine, what we do is focus on the root cause of the problem and take care of the actual issue, and oftentimes many of the other symptoms clear up.
Dr. Roensch, a little bit about what the public can do when they come to the school. They can go to the school and they can be a student, or they can come to the school as a patient.
Well, yes, that's correct. We've been there for 20 years in Sarasota. We're often called the best kept secret in Sarasota, but as we say, we're not a secret anymore. We are a college that produces acupuncture physicians. That's what we do. And we also have on premises a professional medical clinic and then a student intern clinic. So as a student, after a number of years in the program, you're elevated to a position of intern where you're able to treat patients. And so the patient has a choice of being treated by a professional working physician or by student interns at a reduced rate, certainly.
So give us a little bit of an idea. Tonight we're going to talk about diabetes. And you chose this topic, why? Why was this important for you to bring forward tonight to talk about?
Well, probably because there's 14 million Americans with diabetes. 95% of them are type 2 diabetic. You're probably familiar, type 1 diabetes is juvenile onset, they used to call it. That is very rare. And then there's also a type 3 diabetes, which is associated with Alzheimer's. But today, we're going to talk about type 2 diabetes because it's the most common.
Okay. I'm going to give out the telephone number for our viewers. 361-4675 is our telephone number. Please give us a call. We are going to be talking about type 2 diabetes. Type 1 as well, maybe? Is that something that you could address as well?
We could. That's a little more tricky, obviously,
okay,
because the actual pathology of that is the pancreas really isn't producing insulin, and we can't create insulin.
So let's focus on type 2 diabetes then. So tell me, why is this so common?
Well, I believe one of the main reasons is our American diet. So we have the highest rate of diabetes in America. The food that we eat really is not the same food that our parents or grandparents ate. We have food that is all processed, has high fructose corn syrup, soy, corn. It's devoid of any nutrients. So all these sugary drinks, sodas, supersized, this is what leads to diabetes.
Also, we talk about the three key factors to health are rest, exercise, diet. We don't get enough rest. We've already addressed the diet a little bit. And exercise is something that if you look at our populace at large, we are the most obese people on the planet Earth. So beside lifestyle considerations, certainly exercise and diet play a huge role.
So when we think of type 2 diabetes, is that in our history? Is that in our family history? Or this is something that we are creating by our diet?
We definitely are creating it by our diet and environment. There is some predisposition that someone can have, but all in all, it's completely diet and for the most part avoidable with the proper diet.
And are you typically overweight if you have type 2 diabetes, or is weight not a factor here?
Typically, the patient is obese.
Okay. So some of the changes that someone might make. Right now, they might be taking some medicine. What type of medicines might someone be taking with type 2 diabetes?
The most common medicines are metformin. That's the #1 medication out there. But all of those have really adverse side effects.
What is that? What did you just say that was?
An adverse side effect?
No, the name of the medicine.
Metformin.
What is that?
Metformin.
What type of medicine is that? Is there chemicals that you can say that are in that type of medicine?
Oh, well, it helps regulate the blood sugar.
Okay.
So that's basically the main function in insulin. Because what happens is when diabetes, first of all, is basically when you eat something, your body has to break that food down, and it breaks it down into sugar so the body can use it as energy. So that sugar gets released into the blood. So that travels throughout the body, and that increases blood sugar levels. Insulin, once the blood sugar levels increase, insulin's job is to take that sugar out of the blood and burn it into energy. Then after that's done, the insulin level's lower because the blood sugar's level's lower. But what happens is with a diet of high simple carbohydrates, high sugars, insulin is always being released into the blood. And after a while, the body doesn't respond to the insulin. So it's like if you have kids, you're always yelling at the kids, go clean your blender, go do the laundry, do this and do that. And after a while, if you yell at them for so long, they don't listen anymore. They stop listening. Well, that's basically what the body does when insulin is released all the time. It stops responding. So then a person becomes insulin resistant and their blood sugar levels remain high, and then they drop down. So we have hyperglycemia, too much blood sugar, and hypoglycemia, not enough sugar in the blood.
All right. So our phone numbers for our viewers, 361-4675. And in just a minute here, we are going to take a break. I'm not able to hear the control room, so I want to make sure that they know that. But my guests this evening, Dr. Misha Payant and Dr. Stephen Roensch. We are joined by East West College of Natural Medicine, and we are talking a little bit about diabetes and how type 2 diabetes and how maybe using a different approach might be able to make a difference and help you in fighting your diabetes. So when we talk a little bit about medicines and trying to reduce the medicines that you take and still beat diabetes, Dr. Roensch, what can we do that might make a difference?
Well, we have to be careful about this because we don't want to step on any toes. But when we think about in this country, we spend $329 billion annually on pharmaceuticals. And the sad news with that is that $3 billion of those monies are utilized for reaching out and marketing towards the consumer, aka the patient.
Okay.
But $24 billion of that is for marketing toward doctors. And of the $329 billion that pharmaceutical companies take in every year, 14% of that goes for marketing, but only a small percent goes for research. So what we really want to talk about tonight and another time perhaps, is that there are safe proven and effective alternatives to just constantly putting things into the body that the body rejects. The body can only communicate with us actually two ways, and that's by feeling and that's by function. So when a function changes, something that I normally can do this, now I can no longer do that, or I used to feel this way, but now I feel that way, that's the chemical that's introduced into the system communicating with us the only way that it can. We want to talk also briefly about when we talked about some of the things that are called the quins.
Oh, fluoroquinolones.
Yeah, fluoroquinolones that are like the super antibiotic that were introduced years ago. And these were, you may have heard of one called Cipro. And yeah, absolutely, and it's still being prescribed. But when this was introduced, it was designed in a laboratory to affect the replication process of bacterial DNA. The problem is it's a drug and it cannot differentiate between bacterial DNA and human DNA. So what happens is when human DNA cannot replicate itself, literally, Suzanne, the body begins to fall apart. Cartilage in the body breaks down. Tendon rupture is frequent. And these side effects, by the way, aren't temporary or transient. Transient means when you stop taking it, they go away. They're permanent. And they can be early onset, or they can come anywhere between the time you took it and as much as 5 years later. So the side effects are both permanent and they're terrible. So we want, our purpose is to educate our patients into what the alternatives are.
So can you share with us a little bit about some of the alternatives when we come back from our break? So we'll talk a little bit more about some of the things that you can do naturally to help with diabetes and bring your sugar levels in line. And that's really the appropriate way to say type 2 diabetes. We want your sugar levels to be at an appropriate level. And here you are going to be testing mine.
Yes,
coming
yes,
up.
we are.
Okay, well, I haven't been tested in a long time, so I'm kind of curious to see where I stand. 361-4675 is our telephone number. Feel free to give us a call. We would love to take your calls. And we will take this break and we will come right back to Local Doctors on Call. Welcome back to Local Doctors on Call. I'm Suzanne Lee. I'm joined by Dr. Stephen Roensch and Dr. Misha Payant from East West College of Natural Medicine. 361-4675 is our telephone number, and we're talking about natural approaches to curing is that the right word?
Treating.
Treating type 2 diabetes, because you can't make that go away. Is that what we want to say? Or can you?
We can definitely help level out blood sugar levels and even help patients get off insulin if they're dependent on insulin. But cure is a bit strong.
A bit strong, okay.
Let me say this. When we were talking before the break about pharmaceuticals and so on, it's interesting to note that nothing that's ever been synthesized in a laboratory and introduced into a human organism has ever cured a disease. It will mask the symptom, certainly, but it hasn't done that.
Okay, all right. And but with food, with good diet, with good assistance from, I don't want to say medication, but are we looking at another approach here at East West College of Natural Medicine, and what approaches might we be looking at to better work with our type 2 diabetes? Sure.
Obviously the main thing is diet and lifestyle. That said, it's easier to change someone's religion than it is their diet.
Oh, wow.
People usually don't like to make those types of changes. But what we've found that works the best is if we make small changes over a long period of time. Those are the changes that people will stick with. Now, if you were to come into the office and I would say, okay, no more grains, no more carbs, no sugar, no soda.
I would melt down.
You would leave.
Right, I would be very upset with you.
Right.
But how would you work with me? What would you say?
Okay, but if I said, for your first week, I want to send you home with some homework. In your first week, all I want you to do is just pay attention to what you eat. That's all you need to do. Don't count carbs, don't count calories. Just pay attention to what you eat and what you put in your mouth. Every single time patients will come back and they are absolutely surprised at what they actually eat. So becoming just self-aware, body-aware is the very first step.
All right, so I'm going to make a note before we continue. Self-aware is what we want to do, number one. But
Right.
let's take a call from Phil, because I know Phil wants to jump in on this conversation, and then we'll pick it up where we left off. Phil, you're on Local Doctors on Call. Thank you for calling.
Thank you. The question is, I see so many new drugs on TV, one of them called Xarelto. I don't remember the other names of the others. But it seems like there's no research done before it's put out. The amount of side effects are really great. And why is there more testing? I mean, it seems wacko to me, to tell you the truth, that they're putting drugs out that we don't know what's going to happen. There are things like this. I realize there's certain things they said, like possibility of death. Maybe so. A drug company can say, "Well, we warned you," so they can't get sued or something.
Right. Phil, no, you're on to an excellent point. It is all the side effects that are listed during the commercial while you're being marketed to.
But you can't put out a new drug that's Xarelto. I've seen on TV. I don't know. I see it the last 3 weeks or so. That's just one of the drugs. You know, telling you about the death and it's just crazy. It's absolutely nuts.
All right, Phil, thank you for the call. So side effects of some of these drugs and the marketing and all the side effects that are listed. What are some of your thoughts?
If I may address Phil's comment there, there's a little-known area of American law. It's somewhat antiquated, but it's almost unknown. And it's called the Learned Intermediary Doctrine. And basically, it states that manufacturers of drugs are not required by law to personally inform the user of the side effects or the potential harm they cause. They are, however, required to tell a learned intermediary, aka the doctor. So they tell the doctor, well, we've got this drug now and it treats this. There's been some kidney and liver issues, but they're big on the big grand scale, they're minimal. Well, the physician may go in one ear and out the other ear. He may address that in great detail with the patient, or he may not mention it at all. But the problem with this legality here is that the drug company at this point is kind of out of the loop. They mention it to the doctor, and the doctor says, well, there's some side effects. Read the enclosed brochure. The good news is, more than ever before, people are computer savvy, and they're looking these things up, and they're making conscious choices. I don't want that in my body. But there are risks, and again, the only way your body communicates is feel and function, right? But we communicate conversely with our body 5 ways: what we put into it, what we expose it to. The third way is, what do we do with our body? Do we exercise, swim, walk, run, do nothing? How we breathe, and literally how we think.
Okay. We are going to take a break, and we will do that here in just 1 minute. I just want to make sure and give the telephone number to our viewers. 361-4675 is our telephone number. When we come back, I'm going to test my blood sugar as a part of making myself self-aware. I guess that's probably a fair statement. Perfect. I will become self-aware after I do this. We will be right back with Local Doctors on Call. Welcome back to Local Doctors on Call. I'm joined by Dr. Misha Payant and Dr. Stephen Roensch with East West College of Natural Medicine. And we were talking before the break about becoming self-aware in order to battle type 2 diabetes. I have diabetes on my mother's side and on my father's side. And in order to be self-aware, I need to first know what my blood sugar levels are, right?
Absolutely.
So what do we have in front of us, and what will you start doing here?
Okay, so this is just a little machine that you can pick up at any drugstore, $10.
Okay.
So we take a little strip, we just put it in the machine.
And what are some of the normal levels? What do you want to see on this?
So we want to see a blood sugar level of about 70 to 100.
Okay.
And that's typically within range.
Now, if I just ate potato salad, for example, which is all sugar, isn't it? In the end, it just breaks down to all sugar.
Yes, ma'am.
Am I going to have a high number?
Probably a little bit higher, but we want to make sure that it stays under 110.
All right. So what do I do?
So what we're just going to do is just take a finger, squeeze it a little forward to get some blood in, just a little pop.
Okay.
There we go. And put some blood.
And we can do this at home. We can do this at home to be able to monitor ourselves.
Absolutely. And you can keep this in your purse or, okay, so it's 97.
Is that okay? That's okay.
That's perfect.
Perfect.
That's what you want to see.
Even after all that potato salad?
Even after.
Okay. All right. So tell us now, someone will come into the office, you will do this test on them,
Sure.
give them an idea, a snapshot of where they are, and then what happens?
Then what we'll do is find out what their diet is. And how you ask that is ask, what did you eat yesterday? If I ask, what's your typical diet? Every single time a patient's going to say, oh, I have chicken salad, I have salad all the time, I only drink water. But if you ask, what did you have yesterday? They'll tell you, well, yesterday wasn't typical, but yesterday was typical.
Okay.
So you get a really good idea of what they're eating. Ask what their favorite foods are. People are going to eat their favorite food often. So we determine what their diet is currently and how we can make these modifications. And again, it's small changes over a long period of time.
So someone will come in and we will start to make those changes with them on their diet.
Sure.
They have to be a good partner in this, though, right?
Right. They're participating in their own healthcare. That's what medicine is, or supposed to be, is working as a team. It's not giving you a pill just to cure something, because that doesn't work. It's working as a team, small changes over a long period of time, and that's where we see positive results that last.
So would you take someone off their medication if they came to see you, or would this be sort of the gradual goal to reduce medicine, increase results through food and diet?
That's exactly the right way, is to slowly make these changes, and then eventually they will be able to stop taking their medications. But our objective wouldn't be stop medications today. It's a gradual process.
All right. And we have about 3 minutes left in the program, and I just wanted to give Dr. Roensch an opportunity to talk to some potential students out there that might be interested in coming to the school.
Well, first of all, I'd like to say that almost every applicant to the school is turned on by the concept of Oriental medicine, and if you want to call it, and we hate to label everything, alternative, integrative. I like Dr. Payant's intelligent medicine analogy. Generally, when students apply, we ask them, well, what brought you here? And they always, generally, they lean that way. I've experienced it. Either they had an experience by something they read, they had a treatment, something that they did, consciously went and got a treatment, something they saw, something they heard about, but something triggered that in them, and almost invariably, they're all looking for something different, something more natural, something more compatible with a healthy lifestyle. And one of the things that we learn at the school is that patients learn, we spend an hour to an hour and a half the first time we ever see a patient, every patient. And then on the return visit, if that isn't necessary, of course, we don't do it because we don't need to any longer. But we explain what our expectations are of those patients that, like I always say, is two in the canoe. Both of us have a paddle here. We expect you to do your part and play an active role in your own wellness program. So
you will hold me accountable if I come in and I'm not doing my part, because sometimes we need a little guidance in order to stay on track. So you'll hold me accountable?
If you look at allopathic medicine, so often people gave their health over to their physician and go, help me out here. We have a much higher, well, I don't want to say higher expectations, but we can't do it by ourselves. We need their participation. As we said, the rest, the exercise, the diet, the compliant patient role, and so on. Absolutely.
How can people reach you if they would like to come to the school as a student or like to come in as a patient?
They can call us at 355-9080, and we'll provide all the information that they require.
Now, this is the local Doctors on Call for May, but in June, I just want to make sure that our viewers have this in their calendars. PTSD. We are going to be talking about that. Tell us what we will be talking about.
We're going to talk about post-traumatic stress syndrome, how to help people cope with that, and taking a more natural approach. Again, of course, diet, lifestyle, nutritional supplements, things like that.
There are other alternatives to
Absolutely.
Healing yourself after war and after service and coming back from even a traumatic situation here in this country. There are other ways other than just traditional medicine or antidepressants or other medicines to become healthy again and whole again.
Absolutely. Suzanne, there's been over 15 independently randomized control trials where they take patients in 3 groups. They give them Paxil, curcumin, and the combination of the two. The patients responded identically with Paxil as curcumin. There was not much of a response with the two combined. But here we can have a holistic medicine with no side effects.
Please join us in June for our local doctors on call as we address PTSD with East West College of Natural Medicine. Thank you so much, Dr. Misha Payant and Dr. Stephen Roensch. We appreciate you coming in tonight. Thank you so much for joining us. I'm Suzanne Lee. Have a good night.